Dear Sir or Madam, thank you for your interest in participating in Study 678, which aims at examining the curative effect of Santax on lung infections. The following animation will provide you with key information about this study. It will raise your understanding about the risks that may occur and legal aspects that will arise from your participation. Your participation in this study is voluntary. You are free to choose whether you want to participate in this trial or undergo a different treatment. Participating in this study implies that you are taking part in clinical research. The study will be conducted at the Department of Pulmonology at the Central J&P Medical Center. If you participate, Dr. Optovich will be your physician in charge. If you have any questions related to this study, don't hesitate to ask Dr. Optovich or his colleagues. The purpose of this study is to test the curative effect of Santax on lung infection. Symptoms of lung infection include fever, cough, runny nose, breathlessness, and chest pain. Lung infection is caused by bacteria which enter the lung via inhalation and cause bacterial infection. These bacteria live in parts of the upper respiratory tract and are continuously being inhaled into the air cell. Previous research indicates that Santax is more efficient in fighting lung infection than drugs that are currently in use. For the present, this curative effect has, however, still to be proven in a clinical study setting. With your participation in this study, you will help to raise the understanding about the potential curative effect of Santax on lung infection. Santax is a beta-lactam antibiotic. It has many similarities with other drugs that are currently used to treat lung infection. Should you decide not to participate in this study, your treatment may include the administration of one of these drugs. Should you decide to participate in this study, you will undergo a preliminary examination. A physician will take your pulse, listen to your lungs, and take a blood sample. If you successfully pass this examination, you will be eligible to participate in Study 678. The study procedure will look as follows. You will receive 500 milligrams of Santax in the form of a tablet every 8 hours for 2 consecutive weeks. On the 8th day of your treatment, your lungs will be x-rayed to see if any noticeable progress has been achieved. After your treatment has ended, you will undergo a final examination. As, during your preliminary examination, a physician will take your pulse, listen to your lungs, and take a blood sample. Additionally, another x-ray of your lungs will be made. Should you decide to participate in the study, please make sure that you have the necessary time resources to undergo the study treatment and follow the trial schedule. Once you started your treatment with Santax, it is crucial that you finish the whole course of the treatment. If you do not finish your treatment with Santax as intended, your bacteria may develop resistance and become less susceptible to antibiotic treatments. Adverse effects of Santax may include the following: stomachache, headache, vertigo, and itchy rash. Should you decide to participate in the study, you will have the option of stopping your treatment at any time without justification. You will not face any disadvantages with regard to alternative treatments. You will still receive the best available medical care available. Under certain circumstances, you might be suspended from the study by your physician or the trial sponsor. These circumstances include the case that you are no longer meeting the necessary requirements, the emergence of unexpected serious adverse events, and the termination of the entire study. Should you stop the treatment prematurely, or should it be ended prematurely by your physician or the trial sponsor, you will still receive medical care as long as required. Should you decide to participate in the study, you will not have to bear any costs for your treatment. You will, however, not receive any payments for your participation in this trial, except compensation for your travel expenses. Should you decide to participate in the study, you will be covered by insurance for any and all ill effects possibly caused by your participation in the study and your treatment with Santax. This insurance coverage does not come into effect if you violate the instructions of your physician. Thank you for your interest in participating in Study 678. Next, your physician will personally inform you in depth about everything you just heard. It is crucial that all of your questions are answered before you consider whether you want to participate or not.